Hey guys, so today we are going to discuss about the blood supply of heart and the embryology of the heart. So here first looking at this picture, we can see that the surfaces of the heart first. So the superior vena cava draining into the right atrium, and the inferior vena cava draining into the right atrium. So this superior vena cava, right atrium, and inferior vena cava forms the right heart border. Now the right ventricle doesn't forms the right heart border. The right ventricle is the part of the heart, the chamber that is lying most anteriorly. So the right ventricle is lying most anteriorly, and whenever there is a stab injury, the right ventricle is the first one to get affected. In any stab injury, the right ventricle is the first to get um, affected. So what happens now, that in this video we are going to discuss about the blood supply in different parts of the heart. Okay, so blood supply and venous drainage. So this would help us solve the ECG questions also. In ECG, we can know that in which part of the heart which artery is infarcted. So which leads would show the ST segment elevation in ECG. So which lead will show ST elevation? By knowing the arteries that are involved. So this is how we'll solve the medicine questions also after getting this topic cleared. So here we can see in this picture that this is the right heart border formed by the superior vena cava, right atrium, and inferior vena cava. This is the left heart border that is formed by the left ventricle and left auricle. Mind you that this is the left auricle, not the left atrium. That is the left atrial appendage. So this is forming this. Now the arteries, that is from right to left, the arteries are superior vena cava, ascending aorta, and pulmonary trunk. So we can remember it as by the mnemonic SAP. From right to left, these are the arteries. Now these are embryologically they are formed by truncus arteriosus. So embryologically they are formed by truncus arteriosus. So we are covering the embryology of the heart also here, so that the defects, that is the patent ductus arteriosus and transposition of great arteries are covered here. So now this is the anterior surface. This is the anterior most surface of the heart, that is the right ventricle. Now we can also connect with this radiology, that the anterior most chamber of the heart is being the right ventricle. We can see that this is the anterior most chamber of the heart. So this is how we have to show in a radiological CT chest also, that whenever there is pulmonary stenosis, this chamber of the heart would get enlarged, or in pulmonary artery hypertension. And this is the left atrium, that is the posterior most chamber of the heart. Okay, lying anteriorly to the vertebra, this is the posterior most. So this is how we integrate the radiology with anatomy. Now moving to the next one. Okay, so this is the left atrium that is lying the most posteriorly, and the 4 pulmonary veins are draining into it. So this is how we identify the left atrium, which is the posterior most chamber of the heart. Now coming to the blood supply. Blood supply, here we can see that this is the artery in the right side of the heart, that is the right coronary artery. Okay, and it is accompanied by the anterior cardiac vein. It is accompanied by the anterior cardiac vein. And in the left side of the heart, there is left anterior descending artery, that is the main artery, and the branch of it is the circumflex artery. Now this, what the circumflex artery is doing is that it is moving circumferentially. So this is how we can remember circumflex artery. Okay, and this is the left coronary artery. Then here we can see in this atrioventricular groove anteriorly is the lying the anterior interventricular artery, which is accompanied by the great cardiac vein. So first we'll talk about the arteries. So talking about the artery here. Now the arteries are given off by the aortic sinus. Okay, so that is the left horn. So now the first branch of the right coronary artery is the conal branch. Okay, now this right coronary artery runs off between the right atrium and right ventricle, and then on the right side it gives a branch in the right heart border, that is the acute marginal. On the left side, the left anterior descending artery gives the branch obtuse marginal for the left lateral wall. So you have to remember, for the right it is acute marginal and for the left it is obtuse. Okay, now this is your left anterior descending artery, which is the main artery running in the atrioventricular groove. So it runs between the left atrium and left ventricle. It also gives off the branch, that is the circumflex branch, which is running in a circumference from anterior to posterior. Now this left anterior descending artery gives also one branch, that is the diagonal artery. Okay, so it supplies your left ventricle. This was your PYQ, that the diagonal artery supplies the left ventricle and not the right ventricle. Now what happens is, if we integrate this with our medicine, that is the right circumflex artery is responsible for inferior wall MI. It is responsible for inferior wall MI. So it supplies your SA node and AV node. Since it is supplying the SA node and AV node, SA node and AV node gets blocked, which leads to bradycardia in inferior wall MI. So here we can also explain why beta blockers and morphine and nitrates, these are not used or contraindicated in inferior wall MI. Contraindicated in inferior wall MI. Okay, because it is, the patient is already in bradycardia. So this will just worsen the situation. So that is why. Now the leads affected in inferior wall MI is 2, 3 and AVF. So the leads involved are 2, 3 and AVF. So inferior wall MI is like foot. Inferior for foot. So foot wala lead would be involved there. AVF for foot. 2, 3 AVF. Here you can also see in this ECG that we have given here, to simplify this, that this is your lead 2, this is 3 and AVF. So these 3 leads are affected here involved in inferior wall MI. So if we make a foot out of it, it could be easily visualized that this is the foot figure that we see in this inferior wall MI ECG. So this is an inferior wall MI ECG. I think we are very clear here about your confusion regarding why is beta blocker morphine and nitrates contraindicated in inferior wall MI. Okay, so this is the arterial supply of heart. Now the left anterior descending artery involvement can cause septal MI anteriorly, and left circumflex artery is for lateral wall MI. In lateral wall MI, the leads V5 and V6 are involved. Okay, now coming to the venous drainage. Okay, the veins of the heart. So coming to the venous drainage, the venous all the veins the coronary sinus drains into the right atrium. Now they follow the order of great, middle and small cardiac vein. From left to right, it is great, middle and small cardiac vein. Okay, now the posterior vein for left ventricle and oblique vein for right ventricle. The anterior vein is not involved here, like the great, middle and small cardiac vein drains into the right atrium, but the anterior vein drains directly into the right atrium. Okay, they don't drain into the coronary sinus, they directly drain into the right atrium, but the great, middle and small cardiac veins drain into the coronary sinus. Okay, now coming to the embryology of the heart. Now embryology of the heart, we are going to cover that the heart is derived from mesoderm. Okay, and the conotruncal septum is derived from neural crest cells. So which part of mesoderm is heart derived? The heart is derived from lateral plate. Okay, that is the splanchnic mesoderm. So this is where the heart is derived from. Now here we are going to cover that if this conotruncal septum is not there after all, if the conotruncal septum is absent, it leads to patent truncus arteriosus. The conotruncal septum absence leads to patent truncus arteriosus. Okay, and if the spiraling is absent, then it leads to transposition of great arteries. So this patent truncus arteriosus on X-ray gives the appearance of sitting duck. It gives the appearance of sitting duck, and if the spiraling is not present, that is the aorta being on the left and the pulmonary artery being on the right. So here we can see in this image that the aorta is on the right side of the pulmonary trunk. Now why it is on the right side of the pulmonary trunk is because the spiraling takes place in the embryological period. Okay, so the spiraling takes place in the embryological period of the conotruncal septum. That is why it is lying on the right side. The ascending aorta is lying on the right side of the pulmonary trunk. So the spiraling is not present, then it leads to transposition of great arteries. So transposition of great artery is seen in maternal diabetes. That is the overt diabetes, not the gestational diabetes. It is seen in the overt diabetes, not the gestational diabetes, and this is what we see in echo when we detect for this overt overt diabetes complications. So here we see that the paralleling of aorta and pulmonary artery because of the absence of spiraling. Okay, so paralleling of aorta and pulmonary artery is seen because the spiraling is absent. Okay, on chest X-ray we see on transposition of great arteries, we see egg on string appearance. So TR for TR, transposition egg on string appearance or egg on side appearance is what is seen. Okay, so from these when the two tubes of heart combine They from caudally to cranially, we can see the structures that develop are sinus venosus, primitive atrium, primitive ventricle, bulbous cordus, and truncus arteriosus. So the truncus arteriosus, which is the cranial most structure, gives rise to the arteries, that is the pulmonary trunk and the ascending aorta. So it gives rise to pulmonary trunk and ascending aorta. Okay, then this is bulbous cordus, primitive ventricle, primitive atrium, sinus venosus. Now the sinus venosus has is divided into three different veins, that is the umbilical vein, vitelline vein, and what else, common cardinal vein. Okay, so cranially, truncus arteriosus gives rise to ascending aorta and pulmonary trunk. Now, the bulbous cordus gives rise to right ventricle outflow tract. Primitive ventricle gives rise to ventricular trabeculae, and primitive atrium gives rise to atrial trabeculae. Now, this is the sinus venosus. Now, the left sinus venosus gives left part of the sinus venosus gives rise to coronary sinus. Okay, left horn gives rise to the coronary sinus, but the right horn forms the smooth part of the right atrium, that is the sinus venerum. Okay, and the bulbous cordus forms the right ventricular outflow tract. So this is the regarding the embryology of the heart. Now this is important because of the defects that, like the patent ductus arteriosus, spiraling not taking place. Okay, and then what else? We covered the ECG part, we covered the veins part. Okay, and we covered the ECG. So here we can see this is the posterior part of the heart, because most posteriorly is left ventricle, left atrium line. So between, you can see in this image, between left atrium and left ventricle, the small cardiac vein is draining. Okay, and here the middle cardiac vein is draining posteriorly, and this is the great cardiac vein. Okay, this is the left marginal vein at the marginal at the left margin of the heart. Then this is your superior vena cava. Okay, now this is your I told you with this, to remember this with the mnemonic, that is SAP, superior vena cava, ascending aorta, and pulmonary trunk. Now this ascending aorta also gives rise to three branches. So it gives rise to three branches again. Yeah, so this gives rise to three branches, and we can remember it as BCS. Okay, so this is the brachiocephalic trunk, this is common carotid artery, and this is the subclavian artery. So this is the left common carotid artery, this is the left subclavian artery, and this is the brachiocephalic trunk. Okay, so these are the three branches of the arch of aorta, and we can see how we can by the knowledge of the artery involved, we can know the area of the myocardial infarct, that is for RCA, it is your inferior wall MI, which leads to bradycardia and hypertension. That is why nitrates, morphine, and beta blocker are contraindicated here. So this is your PYQ also. Then this topic overall is very important for your NEET, for both NEET and INICET, because this has been asked. So this is it. This is the anterior most lying right ventricle, which is firstly affected in the stab injury because of its location, that is the anterior most. and this is the superior vena cava draining into the right atrium. This is the ascending aorta, and this is the pulmonary artery. So this is it, and this is all for today. Thank you and have a nice day. Also, you guys, I wanted to inform you that we'll be posting regular MCQs in our Google Forms format in the description there below. So kindly solve them. These are for free and available for all of you guys. So enjoy them and utilize them to your fullest, and stay tuned and like, share and subscribe if you want more. Okay, so that's all from my side today. Thank you and have a nice day, and keep working hard. All the best to you all.